everything. They first disappear like for 7 months. Then like in the 9th month, they appear with a photo shoot. When they have only covered up and down. And then the stomach is looking, Rihanna. And you're like, Banange, the day I have a child. You ask the mothers, the real mothers in here, to tell you what you look like when you're expecting. First of all, if you are among the few who can walk normally, that is already. And then first of all, have you ever tried walking in public when you are... That is when you will know that is the serious issue. That is the second lie. Now the third lie. You people, whoever wants, how many people want to have children? All of us. All of us. Okay, you already have, eh? You don't want. Even that is acceptable. Because those things can take over your life. All the rules in the house change, eh? You know, I have a son, by the way. I know, I don't look. So, gentlemen, I have a son and I am single, so the machine works. So, terms and conditions apply. The registration desk is behind there. And all the devices are already available. But let me tell you, this is what happens. Eh? Oh, the other one has got the joke late. While we wait for you. Chokash is on the front table, dressed in new clothes. Whose handbag is this which they are displaying? Hide your handbag. If it doesn't have money. This is what happens. You know when you have a child, that is not the worst part. The worst part is life. Today we are going to, because it's safe motherhood, let me help you. The worst part is life after you've had the child. The moment I used to enter my house shouting, hey, you guys, Wanange! Once you have a child, the child establishes rules in your own house, which you parent for. Imagine the baby, you first enter the house. Is he sleeping? Whispering in my own house as if I don't parent. The maid is like, he's asleep. I said, yes. Then I start tiptoeing in my own house where I'm the one who pays rent. As if it's not enough, I carried him for 9 months. Shh. Also, the maid. Shh. When you are about to reach the bedroom like this, a spoon falls out of the ceiling. I don't know what it was doing in the ceiling. How many? You turn to the baby. Now you're like, where did the spoon come from? The maid is like, why are you still whispering? He's awake. I don't know. I can't stop. But for all those who are planning, so don't worry. Let no one make you feel bad. It is your body. The ministers just reminded us. It is your body. And one of the most traumatizing things about being pregnant for me was dreaming about myself becoming fat. These are the realities of life. I kept dreaming, what if I become very big? And people don't want to talk about these things. But one of the main things I'm going to tell you, people, don't have a child when you are not ready and you are broke. Tell your neighbor. Tuchikolenga abali mu church, achitegedde gamba muno. Don't have a child when you are not ready and you are broke. Mugateko n'ensigo. Ani ayina akabo. This is what happens. Eh? Have you people noticed? Eh? If you pass these clinics where, those are the people, you hear people shouting, woo, wee. People are in labor for 17 hours. 17. You know why? This is my belief. When you are in labor and the baby has reached coming out, the baby first peeps and surveys the environment. Now, if you are broke, this is what happens. First of all, the bed sheets for the baby, your auntie gave them back to you. The onesies, you know the onesies, those things which have buttons, which one cloth. They have measles, but they can still work. Your other sister had them for her first child. So you have clothes like from six relatives. So the baby peeps. When you reach that point when they are saying, push, the baby peeps. The baby sees onesies which have measles. No, let me tell you what happens. Go bypass these nice hospitals where even people, when they have money, when they are going to give birth, you know, it is like they are shifting. Haven't you seen how they show up at hospital? They have 2 suitcases. They have like 7 towels. They have a maid, the sister, the cousin. They have KFC. They have Javas. They have what? Uber is on standby. And then there are those things when you are, imagine when you are broke and you start craving. What are you going to crave when you are broke? People are pregnant, and the baby once said iPhone 14. Oh, now you get pregnant. You are what? You are broke, you are not ready. You reach hospital. These ones, they bring suitcases. When they check into the ward, when you know there is that moment where the doctor tells the attendant, bring what the baby will wear. These ones, they pull out a Gucci towel, Versace bathrobe, what? 6 options. Even the doctor is like, just choose one. Now, for you when you are broke, this is what happens. You already know you leave home knowing what the baby is going to wear. And you make sure the baby doesn't pee in it. You know babies are funny. It's the only one you have. You dress the baby, wash away. Now, it reaches the time of delivering the baby. The doctor starts, push. The child looks. If it is a child, you know you have money, what? Those are the people. That's why you see those people don't take long in labor, like just 30 minutes. They tell the baby, hey, it is my story, leave me. Nga you want to quarrel? Chokanga, you've just taken tea. Excuse me? They say push when you are well to do. The baby comes out like this. But when they say push, nga you are broke. You are not ready. They say push. Also the child is like, They say push. 10, they even induce the baby. Wapi. The child is seeing the conditions outside. They say push. The child reaches a point and does like this. Nasinzira. That's why you see the Isesimanyo mwana was inverted, was facing the wrong direction. Tayagara vayo. They push 17 hours. Finally, Bambi, the doctor checks to see what is the real condition. They find that Simanya, the child, has the umbilical cord tied around the neck. What do you think the child was trying to do? Kagenda ne katunula ebweru ne kalaba ng'embeera mbi olemeddeko kaveeyo ne kagezaako okwetuga. Obwana bugezi. Era bakajjayo nga the child is pissed. Haven't you seen those photos of those babies on social media? You're like, you who doesn't have rent, who doesn't have to deal with the economy, why do you look like this? But the child comes out looking like this. And you people, this is important. There are things they won't tell you about motherhood, but you have to know them now. Me, I'm your friend. I am telling you. Make sure you are ready. Because you may be beautiful, but children can surprise you. You can give birth to a child. You look at the child and say, whose? You look at yourself, you look at the owner, you say, but you. Nga in our family, we don't look like this. Nenga, it has come from you, that is your child. At least it's not easy to carry a child who doesn't look. Every visitor comes, they want to say something nice about the child, but wow. Congratulations. They say, yeah, I'm glad. They're like, who does the child look like? Imagine they're asking the mother who the child. Motherhood, mothers don't need, by the way, this is important. I don't know what is supposed, who are the people we are supposed to be talking to? The ones who haven't yet had children, the ones who want to have? All of them. Which category do you fall in? You haven't had. So you want us to tell you the good things or the bad things? Choose. The good ones. your positive vibe. And let me tell you the good ones. This is the best thing about having children. Children tell the truth. They do what? Yeah. The other day, my son was watching one of these cartoons. You know, they make you, that becomes your life, eh? So I was watching with him, so I started singing the song. You know those songs which be on TV, you've watched the cartoon, now you know all the songs. So I'm singing. Then he looks at me and says, "Mommy, stop singing." I said, "But why?" He said, "For you, you are old." Yeah. Children tell the truth. I know it was supposed to be more positive vibes than that. Eh? The second one, which side do you want? The bad, the good? Still the good. Huh. The problem is once you have one, everyone expects you to have another one. I don't know. Society, this is another thing. They said that, the minister said these are our what? They are our bodies. But the way people ask you, when are you having another one? I repeat, children are not grasshoppers, that the more you collect, the more satisfied you get. In Uganda, we are in the culture of grasshoppers. We are used. Now, mothers are the most stressed people. You don't want to add. Actually, for someone, among the crimes against humanity, there should be the one of telling someone you want them to have your child when they are not ready. Clap for that one, you people. Because there is nothing as scary as unexpected pregnancy. You people, do you know what it means to wait for your period? You have never seen a month that is long like that one. You see people saying, but the month goes by very fast. You being that you have made a mistake. You look at the calendar every day, every hour, every minute. Just one day like this, you start saying, how am I, the adolescents, they know. How am I going to tell my parents? You start looking at the calendar. Day 1 has passed. Day 2. Start praying. I take prayers, eh? There's a way prayers can betray you when you are wrong, eh? You start looking at the calendar. Nothing is happening. But the only thing she has said, prayers. And the only thing I'm going to give you, this is it. There is no problem that you have. Those who want to have kids, put your hands. Those who have already had them. Those who don't want to hear anything called a baby. They don't even want to see it. Then those who wish everyone else. This is the final piece of advice. Just know that problems happen to all the categories. And the only way to solve your problems, do it like the way Christians do. You know how many Christians are here? Christians have faith. You've seen, eh? This is the way Christians handle their problems. When the problem has, you know they have a lot of faith, eh? When the problem has just arrived, eh, they will not show that what? They are stressed. That's why you find them walking and singing, "It is well with my..." It is. I have seen those who pray only on Christmas. They are looking at their shoes, acting busy. Now you know the problem refuses to go away. 3 months, the problem is still. This is how you know they are giving up, but they don't show. The song changes. Soon and very soon. To see that king. Mm-hmm. Now, after that 6 months, the problem is still there. It has refused to go. But as a true Christian, you don't give up. The only thing that shows you have given up is the song they sing at that point. This world is not mine. I'm just... if heaven is... Somebody has even closed the eyes and put up their hands. We are Ugandans. You'll open them when your bag is gone. Thank you, ladies and gentlemen. Let's continue with the program. It's been a pleasure being at the Safe Motherhood Conference. I'll definitely be back. So let's And then to my brother, he claims he's my brother. First come and they see real.
You have denied immediately. You have denied immediately, all these witnesses.
No, he is my brother.
You clap for her, please. This is my sister.
Not brother in Christ, real brother.
Thank you so much. Cotilda is our champion. She has offered to work with us and to reach out to the young people with messages in a more entertaining way. So you're going to see her.
Oh, I forgot to mention that actually. The reason I ended up here, it is because he just paid. No. This is, yeah, of course, Naguru pays, but this one wasn't about money. There is a project that I do. It is called, I started a few years ago, something called Queens of Comedy Uganda, where I mentor ladies who want to do comedy, where I help ladies who want to become better with public speaking, confidence and all those things because of what I went through joining the industry. So that is what I do. However, with time after COVID, we decided to partner with Naguru to go into schools and bring people like you who understand sexual reproductive health and mental health. So what we do, we go to the schools, you people tell them everything that has to do with health, because I'm not an expert on that. And then after that, they get to display their talent. And so we have a partnership with Naguru. Isn't it beautiful? So that's why I am honored to be here at the Safe Motherhood Conference. Thank you for the invite, Joshua.
Thank you for accepting the invite. Let's give her a round of applause again. Great. Dr. Mutumba, I'm honored to invite you, sir, to take on the next session. Let's put our hands together for Dr. Mutumba. One thing I know about Dr. Mutumba is a man of suits. Really? Yes. Really? The other one is for, Dr. Alan is for masks. You, suits.
Yeah, okay, thank you so much. And definitely I see we are running out of time, but it's my pleasure to invite Dr. Irene. Dr. Irene Munyango is a principal medical officer in the division of adolescent and school health. She's going to make a presentation on the current status of school health in the context of emerging issues. And I now want to hand over the floor to her.
Yes, thank you very much, Dr. Mutumba, the session chair. All protocols observed. Good afternoon to you. I'm a bit challenged because we had planned to have a longer presentation, but now I really have to run us through the short presentation to make us catch up with time. I'm going to speak about school health in the context of the pandemic and the epidemic. I'll focus the discussion on COVID and Ebola. So as we wait for the technology, we know that COVID has affected the education sector greatly, but most of the challenges were indirect, not direct. And here, what do I mean? There has been minimal indirect effects of COVID on the education sector, however, many more indirect effects. And the indirect, we all know, speak around the closure, the 2 years. And we know that Uganda has had the longest closure in the education sector. However, when we look at the direct, here we're referring to those who were affected and those probably who we lost life. And this goes up to around less than 1,000 learners were affected in the period. And this started when schools reopened in 15th October 2022, and a number of schools were affected, and these were scattered across the country, starting with Chitigum, Gulu, Chiriandongo, and Oyam. You can see the northern part was affected badly, much as even other areas of the country were, but the northern part had the cases. And I want us to note that the most affected were health training institutions, and I understand why that happened, because these were students, they are learning, and they were interacting closely with the facilities. So that is the picture in terms of the brief of, in terms of the preamble. But what are the key issues that resulted in this 2-year lockdown and thereafter? One, the lockdown greatly contributed to all these issues that we are seeing today, and among which are mental health challenges. You believe me, our learners are greatly affected with the challenges in their mental health. Some could have lost their parents, some could have gotten the disease, some could have, their parents could have lost their jobs. So basically there is a lot of mental health conditions that we are seeing among this category. We are also seeing an increase in the teenage pregnancy. The teenage pregnancy rates have gone high, much as we are waiting for the UDHS to speak to that. But we know in terms of absolute numbers, many girls became pregnant. HIV infection, there has been an increase in the new infections for HIV, and this is attributed to the lockdown. And the last was around other infections, STIs, to mention. We must also have seen child labor. Many of that age category, the school-going children, adopted simple kind of works. You would see them on the streets selling banana, name it. So there was a lot of child labor. Then alcohol and drug use also went on the rise. We know that a number of these school-going children, because of the environment, they fail to go back to school. And this is revealed by a study that was done by UNEB in 2021, which speaks that looking at the primary 6 who are meant to go for their candidate class and then sit for UNEB, there was a drop. Out of 100% were expected, 91% of the learners in P6 who were supposed to be in P7 could not make it because they dropped out. And when it gets to the secondary, that is senior 3, moving on to senior 4, we are seeing 87% attended, turned up for school. So that means around 13% dropped out of school. We also realized the increase in sexual gender-based violence. I cannot overemphasize this. Though in here we are having a challenge in reporting. Many of such cases happen and they are concealed in the community. So what is the call at this point? Adolescents, if there is any kind of exploitation or abuse, please feel free to come. We have toll-free lines that you can quickly, they are anonymous, you can reach out to them so that you can be helped. Now I'll quickly speak around Ebola virus disease. I said my discussion is around Ebola and COVID and relating the two on how they have affected school going. We know that by 14th of this month, a total number of 58 cases had been confirmed, so Ebola is there. And 19 deaths had occurred, with the 20 probable cases registered in the country. But as schools, we realized among these was a school-going child from a primary school. This school is known as St. Peter Junior School. It's a mixed day and boarding primary school in Mubende municipality. So when I talk about mixed day and boarding, you can imagine the kind of interaction. people are moving in and out, the learners. They interface with whatever transport means they are using, whichever household they come from. So about 200 contacts were identified. But as we speak now, the results that have come out, some of those who have been traced, so far none has turned out to be positive, which is a good thing. So we know that schools are places of congregation. And we know that learners, especially the young ones, they do interact a lot. So the chances of transmission due to this body contact, the kind of games they play are really high. So this poses a great risk in the school settings. And I've spoken about the transport means. This was a day and boarding primary school. The interaction through use of boda as a common means of transport, public means, taxis, this really brings out so much risk and exposes very many other people. So what has been done so far in the context of COVID and Ebola? One, there have been standard operating procedures developed by the Ministry of Health, jointly with Ministry of Education, to guide learning institutions on how best to avoid transmission. We have also developed the Ebola virus disease SOPs, which have been shared in the 2 districts of Mubende and Kasanda, and the high-risk districts have also gotten these SOPs. We are working jointly with Ministry of Education and Sports in reviewing the guidelines on prevention and management of teenage pregnancy. You heard in the morning that there is a baby boom. So we don't want these adolescents who have dropped out because of teenage pregnancy to miss out and achieve their full potential. So we are guiding on how best we're giving a second chance to these adolescents to get back to school. I know it is a contentious issue, but I think that is the position of government, to see to it that adolescents who have had teenage pregnancies, they can come back to school. We have also developed guidance on nutrition. We have the National School Feeding Menu, and this gives an idea of how meals, it's not prescriptive, but it gives a clear direction of how meals and nutrition is vital. We know that COVID, in terms of response and in terms of good health, you need to have a nutritious and balanced diet. So the school health feeding menu has been developed as one of the guiding documents that schools need to use. We have also developed the school health standards, and all this we are doing jointly with Ministry of Health, Ministry of Education, Ministry of Gender, that inputs in our documents. And lastly, we have come up with the school health manual or curriculum with support of the partners that are mentioned in there. And this is to guide the service providers in schools on what kind of message, what kind of information they need to share. So in terms of coordination, there was a national steering committee for school health. It was multi-sectoral, and there were a number of key sectors, inclusive of defense, because we know their role, police, in coming up with these SOPs. So there was a structure that led the process of developing these mentioned standard operating procedures. And we also have a school health subcommittee which guides on what needs to be developed in terms of the measures for COVID-19 and the EVD. And this has guided that there is need to have school-level task forces. And these school-level task forces have been instituted, and with the outbreak of Ebola, they have played a role because they were functional, and they were guiding at school level the different measures that need to be put in place to avoid transmission. So in terms of capacity building, there was a launch of the school-based surveillance. This is a system that is electronic, and helps in reporting, alert reporting at school level. Any suspected individual who gets into the school, having built the capacity of the teachers, sends this information, and this information is shared up to the national level. So the key stakeholders at the various level are privy to this information. And I will share with us the kind of dashboard that speaks on the information. At the comfort of our decision makers, we can know where the problem is and action taken very fast. I'm trying to be fast in order here. Yes. So in surveillance, in the rollout of the surveillance system, capacity was built from national up to school level, and this helped us in the establishment and setting up of school health task forces. So there was also a pool of master trainers on infection prevention and control, and this came in timely to avert the transmission. So as we talk in Mubende and in Kasanda, there has already been a pool of trainers who are supporting the two districts in infection prevention and control. This is just a pictorial, the presentation of what happened during the launch of the COVID-19 early this year. It happened in Buganda Road, and I'm happy to mention that the chief guest was the Honorable Minister of State for Primary Health, that is State for Education, Primary and Basic Education, Honorable Joyce Kaduchu. So this is the setup of the surveillance system. We have data collecting tools that are used to capture this information, and it is an electronic system. So information is sent through the phone, as simple as a Kabiriti phone. One can type in, and this information is linked to the health sector as well as the education sector. So this is how the dashboard looks like. So at the comfort of our top leadership in their offices, they are in position to know what is the status in terms of COVID in whichever school across the country. And that is how it's summarized. It speaks around the schools that are reporting, whether there is any COVID positive or suspicious symptoms. That is the summary. And on the extreme right, it's a map indicating for those where the learner or any school provider turned out positive. It's clearly summarized in the dashboard, and our top leadership can attestify to that, and at their comfort, they're in position to make a decision based on the data. So in terms of continuity of essential services, we know that during the lockdown, there was a time when schools needed to open. And what is it that was done to continue school services, even in the phased reopening? So Ministry of Health and Ministry of Education conducted an assessment to establish the readiness of schools. And in here, the key areas that were of focus were, do we have a temporary isolation room? In the event we suspect a learner, do we have somewhere we can separate them from the rest? Do we have hand washing facilities? Do we have fairly reasonable rooms where the learners can study to implement the social distancing? So in terms of essential school-based services, the assessment was done before reopening. Then the other key area was active referral. So schools were linked to facilities to ensure that in case of any suspected learner, that linkage is strengthened and there is no delay, and to avoid mixing. So there was an active referral pathway that was put in place. Then mobilization of infection prevention equipment. As we talk now, majority of schools have at least fair quantities of equipment, specifically the hand washing materials or equipment, because following the COVID, schools did not initially have those equipment. but with the COVID and mobilization from the partners, the equipment are available in schools, and now the challenge is around the practice. You find a hand washing facilities there, but the tendency of learners washing is one of the challenges we're encountering. But in terms of continuity of services, this has happened. Then other services, including menstrual health management, psychosocial support, child health days, immunization, and malaria control have continued. This is a representation of, in terms of malaria control, what has been done in schools, use of edutainment to deliver information on how to control malaria. The next is a demonstration of a mosquito net, and this was done in one of the schools in Nyakashura in a bid to avoid reduce malaria transmission. So what are the experiences that we've encountered in the course of the 2 years of COVID and the lockdown and thereafter? One, compliance to measures has been a challenge. Hand washing, like I said, consistent use of masks, screening for temperature. This was one of the experiences we saw. And now that there is a belief and tendency that COVID has come down, there is a lot of laxity. So I call upon all of us that we should know that COVID is still there and cases are identified, but we thank the vaccination program, the severity has kind of moved down. So what else have we learned? That most schools now have hand washing facilities. The practice is different, but the equipment is in place. We have also learned that prevention management and the reentry guidelines for girls have been adopted, and in some schools, girls are guided and they are given a second chance, and they are in position to go back to do what? They are in position to go back to school and complete their school. Then the school-based surveillance system, though not up to the expectation, but we know that schools are reporting. Any suspected cases are being reported, and this information at the various level, from the district level to the national level, is available and action can be taken. And through the same system, we are now in position to link it to the Ebola outbreak. So I think the surveillance system, which is electronic, will help us even to add in the event of other disease condition, to increase and know timely on any disease that comes up. So the surveillance system is a system that can provide you with information early enough to take action. The other learning is we've learned that schools are a safer environment. I hope you heard the earlier speaker and even the Honorable Minister that parenting really emptied us. So I'm coming to the end. I've been warned. So the other learning is around innovation. We've all looked at the online. Now we're adopting the online kind of sessions, the digital systems that we are using, and it's still these digital systems that are helping us in timely reporting and detection of diseases. Then the issue of active participation and involvement of the adolescent in whatever we do is paramount. Active participation, and not only in such gatherings, but even in planning. So as a division, we are looking at how do we ensure that whatever is being done, there is active involvement of the adolescents. So all this is without challenges. I'll quickly share the challenges or gaps that we have encountered. We know that there's been weak collaboration, especially at the subnational level in terms of departments, education, health, and community development, which I think needs to be really worked on. And most of these emerging conditions really need a multi-sectoral approach. Then, much as the system is in place, we are not there. So reporting is still suboptimal, and we are working around the clock to see that as many schools are in position to report so that we cannot miss any diseases in schools. Then we have policy issues that have delayed. We all know around the school health policy, there are a number of policies that have been delayed, so that is a gap. And the multi-sectoral engagement, I've spoken around it. We've also seen the school dropouts and the related consequences of the teenage pregnancies, the high number of new HIV infection, and the child labor. Then we are still not there in terms of linking schools to facilities. And we think once this is done, it's a game changer. I thank you for listening to me, and I would like to acknowledge the following. Thank you very much, and over to you, Session Chair.
Thank you very much, Dr. Irene, and I think she deserves another round of applause. She ably took us through the effects of these two pandemics, the COVID-19, the Ebola, and I don't want to re-echo what she has mentioned, but in the course of last week, I think it was Friday, our Commissioner, Dr. Jessica Nsungwa, shared with me and the team a post, and I want to read it, especially on this day when we are discussing issues of safe motherhood, but particularly for the young people. This is how this post read. Sad news, primary 5 pupil dies after giving birth. P5. And a 14-year-old primary 5 pupil died at Kagando Hospital, Kasese, 3 days after giving birth. 14-year-old. Now people ask, who impregnates these young, Now, yeah. So, but what was also sad is that 2 days later, the baby also died. The baby also died. And this young girl was impregnated, I will not mention the name, but by a 35-year-old man who is on the run. End of story, So you can see, and even in the previous week, they had reported similar deaths of, 14 and 15-year-old girls, one who had actually died at the home of a traditional birth attendant. You can imagine, as we discuss issues of how do we ensure that, these young girls, first of all, don't become mothers at such an age. But also to further discuss, for those who have become pregnant, how do they safely go through, the pregnancy period and the childbirth period? So I just also shared this because it's a reality. It's a reality, it's a sad story, and we know that the pandemic, of course, that girl should have been impregnated during the COVID-19, the 2021. So as you continue thinking through that, I would like to invite my colleague from the Division of Adolescent and School Health. That's none other than Agnes Seboa. The pandemic has digitalized Uganda. I don't know whether many of you can take note of that. Since we entered the lockdowns, more people have become digital than ever before. And we've had so many digital innovations coming up. Agnes is going to present to us some of the digital interventions that have been developed for improving adolescent health service delivery in the country. Over to you, Agnes.
Yeah? Are you there? Please just raise your arm. Very good. Yes, I'm going to speak to you about the online services for you people for all of us people here. We know that the pandemic, the effects of the COVID-19 pandemic did not leave us the same, as we were mitigating all avenues to see that we control the spread. We saw that information, services were a challenge to access, but that did not mean that we engage in risky behaviors. So with the Ministry of Health, we do have a call center that operates 24 hours. I was very happy for the last 3 months. We received calls from young people, and the issues we call small are very big issues to our young people, isn't it? Issues to do with growing up, issues to do with changes on our body. These are salient issues that we may think that are just simple, but please endeavor to call. Then concerning the online services, I've also ever been like you. I would enjoy speaking to someone I've not seen. I would feel comfortable to talk to someone I've not seen. And with that, we've yielded. Young people have made calls. But again, that one doesn't make you stop going from the facility, because one of the roles of our call center, they counsel. We have good staff there. They counsel you. They link and refer you to the services. And what would be your responsibility is to go where they've directed you to go. And that alone does not mean that we stop there. We know that many of us talk to our friends, we ask them so many things, yet we do not have enough information. But I can assure you, we have counselors and we don't have Lugambo. We are not going to say whatever you've told us. We are very good people. We maintain whatever you have told us about. So for us, we think that with the online services, this is not a one-man duty. I know other sectors like the Ministry of Gender, we have Maristops, our partners with online services. So the question here is, how do we work together to see that our young people get these services? Because we know that at the end of the day, the online services would assist us as young people to make informed decisions and also contribute to the mindset change. Maybe one challenge that we have is that most of us, please can you flash it? Very good. Is that most of us do not know that some of those services exist, and then we end up engaging in risky behaviors and having the other challenges. And also the other big gap that I see is that we normally tend to think that the call center is meant for Ebola, COVID. I was interacting with one of the young people who were taking tea. One of them told us that, but that one is for COVID. It is not for COVID. It is for you. We are going to help you. Please speak to us. So one key message or two that I would like to leave you with is, as a sector or any other key player, let's invest in the online platforms to extend services to both adolescents and young people in and out of school. And we know that the digital platform has raised awareness and also bridged the information gap. Thank you very much. Over to you, Dr. Mtumba.
Yeah, thank you very much, Agnes. And if you, for those of you who have a copy of the conference agenda, I know that around this time, enzymes have started complaining. Some of you are like, but you know, we have peptic ulcers and it's lunchtime. We have just one item to handle before we go out to have lunch. And I believe the team, the welfare team, should be able to inquire with the hotel whether the lunch is ready. But that's a session that we're meant to have as a breakaway session, where young people were to break into small groups and discuss what needs to be done to strengthen the delivery of adolescent. Yeah, so that's a session, young people breaking into small groups. And I'm assuming everybody is young, by the way. So you might be like, hey, what about us who are not? Everyone in this room is young. So we shall be breaking into small groups and discussing what needs to be done to strengthen the delivery of adolescent responsive health services. What is most important that we need from you people are the recommendations, for input into this position paper. This day, at the end of this day, we are going to have a position paper that we shall present at tomorrow's Safe Motherhood Conference, at Golf Course Hotel. So we need to have recommendations. And if we can have just one recommendation from each of the tables, one or two, sometimes when recommendations are too many, they are difficult to implement. But if we can have one or maximum two recommendations from each table, I think we shall be good to go, so that we can include those recommendations, particularly for improving adolescent health in our position paper that we are going to develop. Those of you who are not very hungry, you can actually start thinking through these two recommendations. And I think we may have to, we can agree whether we present them now or you think we present them after lunch. After? I'm told the majority are saying after lunch. So we'll go with the majority and have these two recommendations from each table presented after lunch. These are very, very important. And I want to hand over the microphone to the team that is working on where we are having our lunch from. But I'm reliably informed the lunch is ready. Have a nice lunch. Other people say bon appetit. I don't know whether I've said it right, but thank you.
Thank you so much, Doctor. Can we give him a round of applause? Namwe, something bigger than that. Okay, so we're going to have our lunch. How much time should we give lunch, sincerely? I don't think people are very hungry. Are you? Eh? Sorry? Sorry? Back at 3. So we'll be back at exactly 3 p.m. How many of you do not have coupons? Majority. So what we are going to do is that we are going to use one route. Everyone is going to pass through there. Our lunch is being served from... Which side? Brooks? Pool side. Okay, by the pool side. Please don't take a swim. You'll swim after the conference on your own money. Naguru is not going to pay for you swimming. So we're going to move down to the pool side. We are going to use one exit. There is a lady there that is going to be standing with coupons. Just in case you missed out on a coupon, she'll be able to sort you out. Are we together, guys? Please, let's be back at exactly 3 p.m.